Hi, class 668. My name is Louis Jean Michel. APN scope of practice for world and issue advanced practice. What is a nurse practitioner? Nurse practitioners, NPs, are highly qualified healthcare professionals who work independently to prevent and treat injuries and incidents and manage the patient's overall health. That's from the American Association of Nurse Practitioners. The scope of practice for registered nurses is significantly more limited than that of advanced practice registered nurse APRNs, who hold a graduate degree in nursing and have successfully completed the additional coursework and examinations required to earn an NP license. APRNs also have clinical experience under the belt. In practice, advanced practice registered nurses do many of the same tasks as physicians and medical assistants. Physician assistants can diagnose and treat minor to major ailments. They examine patients, request diagnostic tests, read results, offer consults, and prescribe medications. How does a nurse practitioner differ from a physician's assistant? A nurse practitioner differs from a physician assistant in various ways. For instance, nurse practitioners often train on the nursing model, focusing on testing, diagnosing, and treating patients with illness. In contrast, physician assistants prepare using the medical model similar to doctors and thus concentrate on treating the patient conditions. Accordingly, NPs differ from physician assistants because they have full practice authority to practice in any state, while physician assistants work independently with doctors. Consequently, unlike physician assistants with more generalized medical education, nurse practitioners have specifically fields such as pediatric care, neonatal care, and psychiatric care, among others. How does a nurse practitioner differ from a physician? We continue. Nurse practitioners differ from physicians in various ways. For instance, NPs are required to have a nursing background as well as a bachelor degree of science in nursing degree, after which they must complete either an MSN or a DNP program for further education. In contrast, more years of education are required for an individual to become a physician: 4 years of college, 4 years of medical school, and at least 3 years of residency training. Accordingly, NPs differ from physicians because they are trained to diagnose and treat many common medical conditions and can be prescribed medications. Still, they do not have the same training and expertise as physicians. In contrast, physicians are licensed to diagnose and treat a wide range of medical conditions, and they can perform surgical procedures. Why don't you just become a physician? There are various reasons why I would prefer to become an NP instead of a physician. Firstly, an NP focuses more on patients' care, since they may have more time to spend with patients than physicians, who usually have more administrative responsibilities. Besides, I would prefer to be an NP to a physician, since in some states, NPs have more autonomy in the practice than physicians. They may be able to diagnose and treat patients, prescribe medications, and order and interpret diagnostic tests without the supervision of a doctor. I prefer becoming an NP to a physician since it requires also less time in school, less education and training than the latter. Those are my references, and based on that, I say thank you for listening.